Your patient is a 22-year-old man who has been on a low budget trip to India where he ate many of the local foods, okay, like some American and all. That fellow had a low grade fever, anorexia, mild abdominal pain for about a month. You suspect that may have typhoid fever, okay. If he does have typhoid fever, suppose confirmed up, which one of the following is the least likely laboratory finding? Remember, he is asking up least likely, not the most likely. So don't confuse up. This is the trap of the examiner. Okay, remember this trap. First thing, the culture of the blood reveals gram-negative rods. Yes, Salmonella typhi is a gram-negative rod. The culture of the stool shows lactose-negative colonies in EMB agar. What is EMB? Eosin methylene blue agar. Yes, true. His serum contains antibodies that agglutinates Salmonella typhi. Definitely it should have. His serum contains antibodies that cause positive Weil-Felix reaction. No. The answer is D. Weil-Felix reaction is not done for it. It is done for Proteus and the rickettsial family members. It is not done for the Salmonella typhi. So answer to this question is D. Least likely it is this. Okay. In fact, it is not possible. Then regarding typhoid, what I want to tell you that fecal-oral contamination happens up. The incubation period is around 14 days. Okay, 7 to 14 in fact. Besides this, which type of fever? Step ladder pattern. Which type of spots? Rose spots. Which type of ulcer? Longitudinal ulcer. How to remember? Typhoid, tie. It looks like a tie. Typhoid fever is having longitudinal ulcer. Transfers is seen in TB. Okay. What about the investigation sequence? BASU. First week, second week, third week, fourth week. Blood culture, agglutination, stool culture, urine culture. These all you already know. Okay. Agglutination is which test? Vidal test. Vidal test you look out for which antibodies? O and H. Okay. Which comes first? O comes first. O goes first. Okay. H comes late. H goes late. Okay. So that also you need to remember regarding the antibodies, and you look out for the titers of them. That is not fixed. As such, for the H 200, for the O 100. Above that. Blood culture, you know that you use Castaneda method. You can use here also Castaneda method. And that ratio of the blood and the culture fluid should be 1:10. And you add up a particular thing here that is termed as SPS, that is sodium polyalethol sulfonate, which acts as an anticoagulant and which also have a like antibiotic sparing effect. Okay. Stool and urine, these they are like brought up in which enrichment media, guys? Selenite F broth. And which is the best selective media if somebody asks you? That is the Wilson and Blair. And this Wilson and Blair is having which type of colonies? It is having jet black colonies of this particular Salmonella. Jet black colonies. Okay. And which is the transport media if somebody asks you? That is the Sachs. Now you will say that this is for Shigella, sir. This is for both. The Sachs media is a transport media for both. And what is the transport media? The transport media is the media which is used to transport. Okay. In fact, what is the meaning of this? That it does not allow the growth. It does not allow the multiplication. Only the viability remains on this transport media. That is the Sachs media. Okay. A drug of choice, you already know. Third generation cephalosporin is the drug of choice for the typhoid fever. And that can be easily being cured up with that particular one.